Hello, dear followers. Today's surgery is for lung cancer. Before going into surgery, I wanted to talk to you about lung cancer. You can watch its content from our video. Lung cancers are the most common type of cancer in both genders worldwide. The reason is smoking. It is necessary to stay away from cigarettes and tobacco products to protect yourself. You will say that it does not create a problem for some people. Yes, he may not have created it, but that doesn't mean you won't create it. Moreover, smoking can cause not only lung cancer, but also other types of cancer. Now, at what time should we perform surgery on lung cancer? Allow me to demonstrate to you at this moment. This is our breathing tube. Right lung and left lung. Our right lung contains a small lobe in the middle, similar to this. There are a total of 2 large lobes. The left lung is divided in half into 2 lobes of equal size. There is a tumor present in this location, and the approach to treating this tumor involves more than just performing a standard resection that we typically aim for. This is a treatment where the artery that goes to the upper lobe, the artery that goes to the lungs, and the bronchus are connected, and the entire upper lobe is surgically excised. We can achieve this with open and closed methods. The closed method is significantly superior in terms of the patient's comfort and convenience in the short term. There are benefits such as reduced infection and shorter hospitalization. However, the closed method is not required for all surgeries. For instance, when tumor location is here and it's very large, open surgery may be preferred. Or more can be taken from a lobby. Even the whole lung can be removed. Or sometimes the broach we call cylindrisection is cut from here. This upper part is taken, the 2 lobes on top, and then the broach here can be sewn end to end to the clean main bronchus here. This is a sample translation. If the same is done similarly, double slib resections may be necessary. All of these can be done using open or closed methods. This surgeon's experience may be related to the center's experience and may be related to its equipment. In lung malignancies, keep in mind that the primary therapeutic approach is surgical intervention. In cases where surgery cannot be performed, other treatments are offered as alternatives. But this is a genuine treatment. Well, we administered these treatments, we underwent surgery. If more treatment needed after surgery, we got more treatment. How are survivors? I always get this type of question. Allow me to clarify. If we're talking about stage 1, if the tumor is identified at an early stage, the rate of survival after 5 years is approximately 70%. However, if the condition has progressed to stage 2 to 3, which is characterized by a range of 45-55 for stage 2 and 40-55 for stage 3, or 25-30 for stage 3 in the advanced stage, the maximum likelihood is CEN5. When we reach stage 4, it's 1%. So imagine we give a 70% 5-year survival rate for stage 1 cancer, and we give a 1% survival rate for stage 4. Early detection is of utmost importance. So what does this signify, this 70%, 1%? Let me also explain that. When we use the term CEN1, it means that only 1% of the patients survive for 5 years following a diagnosis of lung cancer. Similarly, if you look at stage 1, 70 out of 100 patients will not die from cancer after 5 years when the correct treatment is applied. The reason for this difference in percentages is also dependent on whether surgery is performed or not. Therefore, surgery is the primary treatment for lung cancers. Thank you very much for listening. I hope my video has been helpful.